Whoa, it's not all bad news. I talked about the extreme before going into the extreme in a gentle manner as I normally do. So, can you get pregnant naturally if you have adenomyosis? Yes, many women with the milder form of adenomyosis have fallen pregnant naturally. Now, note I've said mild. If you've been told that you've got moderate adenomyosis and you are still keen on trying to fall pregnant naturally, go straight for a fertility specialist who may try the first line treatment, which is an oral contraceptive pill, or a gonadotropin or progestin therapy. These not only help with the symptoms, but attempt to shrink the endometrial tissue found within the muscle wall. In severe cases, there have been some fertility specialists who have attempted myomectomy, and that simply attempts to remove the endometrial tissue from the uterine wall. Now, the trouble with that is that obviously you can't go too deep into the uterine wall because you risk scarring, you risk also perforating so it's a very delicate surgery that should only be attempted by a surgeon who is very experienced in the field, and even then you still have risk. If God's grace you didn't get a uterine perforation, there are other risks like infection, and also when healing occurs you may get scarring. Now remember, with adenomyosis it can reoccur, so you can remove the endometrial tissue but it may grow back into the uterine wall. So if you go for an adenomyomectomy for the purpose of trying to conceive, once it's been removed and the surgeon reassures you that a lot of the tissue has been taken away and you want to get pregnant, you need to get pregnant fast. If your uterine wall after the endometrial tissue has been removed is less bulky and there's less inflammation going on, then you could consider going for IVF. Now, remember, if you've just had this procedure, you need to give your uterus time to heal and for the inflammation to settle before you try going for IVF. But it's a bit of a catch-22 because you can still, whilst you're waiting for the inflammation to settle, the endometrial tissue might grow back into the myometrium muscle wall.